Preload refers to how much the wall of ventricles stretches. We know that when ventricles are receiving blood, they stay relaxed and slightly the wall of ventricle opens up, stretches, and the more the ventricular wall stretches, the more ventricles receive blood from the atria. Myocardial contractility refers to the force that ventricles generate when they contract. And obviously, if ventricles generate more force, they can manage to pump more blood out. Also, let's recall that if we manage to help our ventricles to pump more blood every time that they contract, the volume of blood that ventricles pump in 1 minute is going to increase. So those factors that increase stroke volume, they increase the cardiac output. To understand exactly how myocardial contractility and preload help increasing stroke volume, we use Jack and Tom, identical twins. First glance, we do not notice any differences in the anatomy or physiology of their heart. However, when the time comes for their ventricles to open up, to stretch and receive blood, we notice that ventricular walls of Jacks open up, stretch more. Clearly, that means that Jack's ventricles are receiving more blood from the atria. So that's the conclusion that we make, that if ventricular walls stretch more, open up more, ventricles receive more blood, and as a result, they can pump more blood out. Recall that the amount of stretch in the wall of ventricles would be referred to as preload. So here, in short, we can say that preload in Jack's heart is higher. And recall, when ventricles receive more blood, at the end of their relaxation, they have more blood. That would be end diastolic volume. So increasing preload leads to increasing end diastolic volume, and as a result, how much ventricles pump blood out each time that they contract, stroke volume would be higher. Then we notice that increasing preload, how much the wall of ventricles stretches, within limits can actually help ventricles to generate more force. Think about this like the story of a rubber band. Within limits, the more you pull the rubber band, when you let go, it snaps back more forcefully. So that's exactly what is happening in the ventricles. However, to help ventricles to generate more force, also adding to the thickness of the muscles in the wall of ventricles is a factor. And we know how in a healthy way we can add to the thickness of the myocardium in the wall of ventricles by regular exercises. So quickly, we're talking about those regular exercises that involve large body muscles. Specifically, we're talking about aerobic exercises that involve many of these large muscles, and they should contract for at least 20 minutes. This leads to stimulating the cardiac muscles to accumulate more protein, so each cardiac muscle cell becomes thicker, goes through hypertrophy. And we see that the myocardium of ventricle as a result gets thicker. And this is physiological cardiomegaly. Please keep in mind, in a physiological cardiomegaly, not only ventricular myocardium is thicker, but also preload is higher. It means that the wall of ventricles manage to open up and stretch more. So the conclusion is, if we lead to physiological cardiomegaly by regular exercises that I mentioned, the advantage is that we increase preload and also increase contractility. And as you see, increasing preload leads to adding to the volume of end diastolic volume, and in general, increasing both preload and contractility leads to adding to how much blood ventricles pump out each time they contract. Stroke volume goes up. And when stroke volume goes up, how much blood ventricles pump out in 1 minute, cardiac output increases.